Great. Thank you, Charlie. I think Dr. Wyckoff has done a really nice job of reviewing that phase 2 data, which has really helped kind of lay the foundation to how the phase 3 studies and the pivotal program has been designed. So I'm going to spend a few minutes talking about those trials. So let's go to the next slide. We talked a little bit about the data and the breakdown in phase 2. And so again, using that to inform us on how we're going to optimize the phase 3 program, we see that, in terms of the actual primary endpoint, we're looking at hierarchical primary analysis being conducted first in the high-responding occult and minimally classic population, again, excluding RAP lesions, followed by the analysis of the total patient population. We will be looking at 2 robust pivotal trials studying Sozinibercept in combination with both Eylea as well as Lucentis, depending on the study we're talking about, in treatment-naive patients with wet AMD. These phase 3 studies, as you'll see, are designed to support broad label for use in combination with really any VEGF-A inhibitor for all wet AMD patients, treatment-naive or previously treated patients. Let's go to the next slide. So let's talk a little bit about the phase 3 program. If you look at the study design, these are multi-centered, double-masked, randomized, sham-controlled studies. And I'll go a little bit into the randomization in a few slides. These trials enrolled treatment-naive wet AMD patients. Really robust trials. We're talking about 990 patients approximately per trial, which breaks down to 330 patients per arm if we randomize 1:1:1. And in that, we're also breaking it down into looking at Sozinibercept at 4-week intervals, as well as 8-week intervals compared to the sham control. The comparators we're using, again, depending on the study, in the COAST trial, we're looking at 2 milligrams of Eylea Q8 weeks, and in the SHORE study, 0.5 milligrams Lucentis Q4 weeks. We're looking at the highest regulatory quality with 90% power and 5% type 1 error rate. Next slide, please. The primary endpoint, what are we looking for in these trials? We're looking at mean change from baseline in BCVA at week 52. These patients will be followed out to week 100, primary endpoint being at week 52. Key secondary endpoints being how many patients gain 15 letters or more, or in other words, 3 lines of vision or more, 10 vision letters or more, as well as anatomic endpoints looking at choroidal neovascularization area, and proportion of patients with absence of both subretinal fluid as well as intraretinal fluid or CIS. Next slide, please. And this is a really nice diagram just breaking down visually how the trials look. So on the top, we're looking at the COAST study. The COAST is using aflibercept Q8 weeks, and we'll be combining that with Sozinibercept Q4 weeks or Sozinibercept Q8 weeks or sham control. Again, looking at primary endpoint at 52 weeks, patients being followed out in terms of safety to week 100. And then we have the SHORE study, which is looking at ranibizumab Q4 weeks in combination with Sozinibercept Q4 weeks or Q8 weeks or versus a sham Q4 week. And that is almost fully enrolled, looking at anticipating within the next few weeks or so for the SHORE study. The next slide. So this program, and I can really just reiterate what Dr. Kanani and Dr. Wyckoff have said, is really has the potential to transform how we treat wet AMD in our day-to-day clinical practice. This study itself, these studies are designed to support that potential broad label use for combination with really any anti-VEGF therapy, and also provides data on Sozinibercept's durability. We're using it at Q4 week intervals and Q8 week intervals, depending on the treatment group we're talking about. And they're well-powered, robust pivotal trials. We said 990 patients per study, so it's optimized for success with the primary analysis on a high-responding patient population. It is, again, the only late-stage therapy targeting superior visual outcomes, and we're hoping to get top-line data mid-2025.